Yeah, my name is Haraldur Bjarnason. I'm the chair of Vascular and Interventional Radiology at the Mayo Clinic in Rochester, Minnesota, United States.
Okay, thank you.
This is my fourth time here in Cáceres. I came here probably in 1996, the first time. Prior to that, I had been in Houston, Texas at MD Anderson, where they have a similar course. And I had also participated in many courses in Oslo. Many of the people that are here teaching participated also in the same courses, both in Oslo, at MD Anderson in Houston, Texas, and other places. So I was familiar with this, and I was invited to come here approximately in 1997, and this is, as I said, the fourth time I come here. Yeah, deep venous thrombosis is when the blood clots in the veins, and typical treatment for that is anticoagulation or blood thinners, using heparin and heparin-like drugs, and then Coumadin, which is tablet forms for blood thinning to prevent further clot to form. Now, there is evidence to support that you could improve the long-term outcome of deep venous thrombosis by actually dissolving the clot. We've been doing or giving treatment like that for many years. It hasn't really caught on, but the main way we do that is we will puncture a vein in the leg, bring a catheter into the clot, leave it in the clot, and then infuse a drug to dissolve the thrombus. We also have mechanical devices that will help to break up the thrombus earlier, but in most cases we also have to give thrombolytic agents or drugs in addition to the mechanical thrombectomy. This is still in evaluation. There is a study starting in the United States in January or February of next year, where patients are going to be randomized to either heparin and Coumadin or to active therapy, where we try to remove as much of the clot and then place the patient on blood thinners. The ultimate outcome from that will be to see if we can improve the long-term outcome from deep venous thrombosis by actively getting rid of the thrombus. I'm certain that simulation of any sort before people start doing procedures is important. It will improve the quality of the work, and it will also improve the safety, which is very important. And this is something that the medical community is very focused on right now, safety and quality. There are simulation centers being developed throughout the world, where people do procedures on machines using simulation. And there are also courses in other parts of the world using animals as simulation centers. This is by far the most advanced center for that purpose. I'm certain that both using simulation centers and animals is a huge step forward in improving the quality of the procedures and also the safety for the patients. So endoluminal techniques for vascular disease have in the past 10 to 15 years replaced surgical techniques, open surgical procedures. Vascular surgeons have come to realize that many of the things that they did by cutting the patient open in the past can now be done as well and more safely by using endoluminal techniques. It is important for them to be able to develop the technical skills before they do the procedure on patients. It is safer that way. The quality is also improved that way. So I think the approach that's being used here at the institute in Cáceres is a very good example of how you can improve the teaching of these procedures, both to radiologists, cardiologists, and to vascular surgeons, or anyone that wants really to practice that.